In Zambia, infectious diseases remain an important public health issue that casts a heavy burden on the country. ZNPHI has led efforts to combat infectious diseases in Zambia since its establishment in 2015.
I want to talk to you about the Zambia National Public Health Institute, which is a quasi-government entity that was established by an Act of Parliament of 2019, the ZNPHI Act. This act mandates the institute to provide disease surveillance, public health intelligence work for the government of the Republic of Zambia. Now, the ZNPHI has had a long working relationship with the JICA teams, and we work with JICA in various ways. And that work has really been heightened since our engagement during the COVID-19 pandemic. And since then, we've had constant work with teams from JICA who are integrated within the ZNPHI.
In April 2023, ZNPHI and JICA took their partnership to new heights, leading to the launching of a new 5-year project entitled the Project for Strengthening Laboratory-Based Surveillance for Infectious Diseases.
I am Dr. Kunda Msonda. I'm Director of the National Public Health Laboratory Services Department at ZNPHI. So this is the department under which we have the Zambia National Public Health Reference Laboratory. So this project has 3 main areas of focus, or 3 main outputs that we are looking at. The first output is to ensure that capacity to detect target priority pathogens is built within the Zambia National Public Health Reference Laboratory. And here we are focusing on 2 main disease areas. The first area is what we are calling the acute gastroenteritis, or AGE in short. And here we are using cholera as the model disease. So we are detecting the causative agent for cholera, which is Vibrio cholerae. And the second disease area that we are focusing on under this first output is actually rabies. Unfortunately, rabies is a very fatal disease, especially once somebody becomes symptomatic. But we are trying to, through this project, establish that capacity to detect rabies as early as possible, so that we allow for appropriate interventions to be put in place. This one is focusing on improving the management status and capabilities within the reference laboratory, the Zambia National Public Health Reference Laboratory. And we are actually setting ourselves up on the path towards international accreditation.
In the effort to strengthen ZNPHI's capacity to conduct laboratory-based surveillance for infectious diseases, activities are underway to establish a surveillance system, particularly for acute gastroenteritis, including cholera in Zambia. The project is working together with healthcare workers in 5 surveillance sites located in Lusaka, Central, Eastern, and Northern provinces as of 2024. In Lusaka, 2 surveillance sites have been operational since December 2023.
My name is Tadatsugu IMAMURA, Chief Advisor for Infectious Disease Surveillance from Japan International Cooperation Agency, JICA. So in this facility, we are supporting Zambian National Public Health Institute officers, as well as the healthcare workers, to collect stool samples, as well as the clinical and epidemiological information of patients, diarrheal disease patients, so that we can have a better understanding of the etiology of diarrheal diseases in Zambia, as well as to build scientific evidence to further strengthen the infectious disease projects to control the diarrheal disease epidemics in the country.
In order to provide scientific evidence to support effective public health intervention, laboratory management plays a crucial role in delivering a reliable laboratory test for those samples collected through surveillance and outbreak responses. The project was designed to strengthen mainly 3 target areas of laboratory management, which are the quality management system, biosafety and biosecurity, and equipment management.
My name is Chiho. KANEKO, working at ZNPHRL as a JICA expert in laboratory management. Laboratory management is an essential practice at the laboratory, ensuring safety of the laboratory itself and laboratory personnel, and also the surrounding environment and society is the top priority to operate a laboratory. And on top of that, there must be high quality of research and testing that laboratory provides. Also, the well-managed equipment is essential to ensure such safety and also the high quality of research and testing. And furthermore, inventory must be well managed to supply the items necessary when it's needed.
My name is Miriam Kaonga. I am the Assistant Biosafety and Biosecurity Officer here at Zambia National Public Health Reference Laboratory. Here in terms of biosafety, we are trying to implement biosafety and biosecurity measures with the help of JICA. So in terms of trying to contain the pathogens and the contaminants that we're dealing with, we've divided the lab into different zones. So we have the blue, we have red and orange. So these different zones have been divided depending on a risk assessment which we did before, and we have dedicated PPE to the different zones. So if you're wearing the PPE that you're wearing in the red zone, you can't move with it going to the next zone. You're just trying to contain and reduce contamination.
From the time JICA came on the project, we've seen a lot of improvements in terms of our quality management system. We've capacitated a number of our laboratory staff on issues to do with biosafety and biosecurity. We've also capacitated our laboratory staff on quality management system. We've seen trainings that have come along in terms of detection of rabies viruses. There's been an introduction of the geoelectrophoresis PCR that has helped us to detect pathogens that we were unable to detect when we began service here.
I must take this opportunity to thank our Japanese counterparts through JICA who are facilitating trainings, for example, in ensuring that our ability to properly handle samples for anthrax and be able to process them, that capability is enhanced through training. So we do this jointly, including with our colleagues at the University of Zambia School of Veterinary Medicine, the Central Veterinary Research Institute, and others at government level. We belong to other networks of laboratories that are important for us as a country to ensure that we are able to quickly detect these public health threats when they arise. We confirm them, and then the appropriate actions, public health interventions can be undertaken, and we continue to monitor during the course of the outbreak until it is declared over.